Welcome back to Cutting the Boards. In today's video, we will discuss 20 trauma, critical care, and burn topics that will definitely be on the Absite exam. So let's get started. Starting off with trauma, it's really imperative that you know the ATLS classification of hemorrhagic shock and how to distinguish the different classes. There'll be a table on the following slide. GCS calculation will be an easy point on the exam. Remember that the I component has 4 points possible, the voice has 5 points possible, and motor has 6 points possible, and that motor is the best classification of neurologic injury. For point 3, remember that a positive FAST that is unstable will go to the OR. If a patient is stable, that is okay to proceed with imaging for further diagnosis. And then if initially negative, if a FAST is initially negative and a patient becomes unstable, then quickly repeat the FAST and proceed with the next step. For ED thoracotomy, remember that it's a controversial topic, but for the point of Absite, they typically test on blunt being less than 15 minutes of CPR and penetrating being less than 10 minutes. So that's an important point to distinguish. And then with TEGs, there will be a slide following, kind of giving you more information about TEGs. The most important thing to remember is with a prolonged R time, you're going to give FFP. With a low alpha angle, you're going to give cryo. With a low MA, you're going to give platelets. And then with a high LY30, you're going to give TXA. So this is an important slide kind of showing the classification of hemorrhagic shock. Important points to note that in class 2, when we look at it, they'll have a normal blood pressure, but they'll have a narrowed pulse pressure, and they'll have a mildly increased respiratory rate. In class 3, that's when you start to see hypotension. So the important takeaway is that, for a patient that's lost a sizable amount of blood, a liter of blood, they may not show hypotension until, they get into the 1.5 to 2 liter territory, and then you'll start to see the hypotension. Here's the GCS scale. Really important to know the scale, not only for the exam because it will be an easy point, but also for whenever you have a trauma and you're trying to diagnose the GCS as part of your ABCDEs of trauma. Next is the TAG. Really less important to know the graph. From my experience, it's more so important to know, which blood product to give, depending on, what the TAG values show. Looking at more trauma topics, so indications for the OR following thoracic penetrating trauma. This will certainly be a question. Greater than 1.5 liter of output at the time of chest tube placement is an indication to go to the OR, and then 200 mils per hour over a span of 4 hours is also an indication. It's come up in the past with calcaneus fractures, especially bilaterally. You definitely want to evaluate for spinal fractures because the force needed to cause a calcaneus fracture can easily cause a vertebral injury as well. And then for viable pregnancy age, it occasionally comes up, and this is generally considered to be greater than 24 weeks of pregnancy. Moving on to critical care, really important to know the types of shock and how to differentiate between them, comparing the SVR, the CVP, and the cardiac output. There'll be a slide following with the chart that you just have to memorize. Surviving sepsis guidelines, I would know these. They're tested every year. And just know, how much fluid to bolus a patient, and what are the guidelines for surviving sepsis. For point 11, distinguish between ventilator settings. Essentially, for most of the questions on this topic, they're going to show you a vent readout, and they're going to ask you which ventilator setting the patient is currently on. For point 12, know how to calculate the ratios for ARDS. So it's the PaO2 over the FiO2, and that'll give you the P to F ratio that can help you classify the severity of ARDS in a patient. And just know that vent strategies include a low tidal volume of 4 to 6 mils per kg, and then prone positioning is also a potential treatment just to help aeration in severe ARDS. Know that perioperative steroid management, you just have to memorize it. And then for CARD studies, there's typically a question that will give you a respiratory quotient, which is calculated by the CO2 produced over the O2 consumed, or it'll give you those two values, make you calculate a respiratory quotient, and then based on the fat, the protein, and the carb baseline values, you need to be able to adjust tube feeds based on the CART study results. There's a few questions that are going to come out of this chart, so I recommend just pausing the video and testing yourself on the different variables and thinking about how they differ in the different types of shock. Moving on further with additional critical care topics. So an important one to know about clinically as well as for the Absite exam is abdominal compartment syndrome. And this is when with a paralyzed bladder pressure, the intra-abdominal pressure is greater than 20 millimeters of mercury, and the patient has multi-organ failure. So symptoms will include a distended abdomen, oliguria, increased SVR, increased airway pressures, and then the decompressive laparotomy is the treatment for these patients. And then for pulmonary embolus, very important for patients who are immobile, for patients who are not on DVT prophylaxis or have contraindications to DVT prophylaxis. I would have a high suspicion on the exam for a PE in a patient that has a sudden oxygen requirement change, as well as clinically in the hospital. And then heparin is typically the treatment of choice, as well as thrombectomy for a saddle PE. So with burns, there's really only a few topics that are testable. For topic 17, know the degrees of burn, so what makes a first degree versus second degree, and which degrees of burns will present with pain. For point 18, know the rule of nines. You'll see the image to follow on the following slide. And then know the Parkland formula and how to calculate how much fluid a patient will get, and then how often they'll get that fluid. For number 19, clinically important as well as important for the Absite. If at all concerned for an airway injury, really imperative to obtain a bronchoscopy. And then 20, probably the most testable topic from burns, to know the side effects that come along with these medications. So silver sulfadiazine causes neutropenia and thrombocytopenia. Mafenide acetate causes metabolic acidosis. And then silver nitrate can cause electrolyte derangements and methemoglobinemia. The MA and mafenide acetate stands for metabolic acidosis in my mind. And then the N in silver nitrate, I think of N as nutrition, so I relate that to electrolytes. And that's just kind of my mnemonic for remembering those. Here's a picture of the rule of nines as well as the Parkland formula. Again, should be an easy point on test day if you just remember the picture. So that was an overview of 20 trauma, critical care, and burn topics that will certainly be on the exam. Again, thank you for tuning in to Cutting the Boards. I'll see you in the next video. Good luck studying.